From ABC News, this is Good Morning America. Now from Times Square in New York, weekend anchors Bill Weir and Kate Snow.
Okay, Marisol, we turn now to the latest in plastic surgery. No surgery at all. In the amount of time it takes for you to eat your breakfast this morning, you could be in and out of the doctor's office with a whole new look. In our new series, The New Face of Plastic Surgery, we look at what's being called the 15-minute nose job. Here's ABC's Andrea Canning.
Yes, it's the most defining and sometimes interfering feature on your face. And with all those different shapes and sizes, it's no surprise that Americans are obsessed with wanting it to look perfect.
I've wanted a nose job for a very long time, and I've considered rhinoplasty, but I don't think that I'm physically and emotionally ready to go under the knife.
And she won't have to, with a new, non-surgical, virtually painless alternative pioneered by cosmetic dermatologist Dr. Cameron Rokhsar. Using small amounts of a cosmetic dermal filler known as Radius, he can smooth out the bumps and instantly restore a more symmetric look to your nose in just a pinch. Dr. Rokhsar injects Radius into the marked areas, then molds it, contouring the gel-like substance into the shape of a natural-looking nose. And after just 15 minutes...
Looks great.
But for some, it's more about actually creating a nose rather than just correcting it.
Throughout my life as being Filipino, they say that I don't have a nose bridge, so everyone keeps on saying, oh, you should get a nose job done.
And unlike the traditional rhinoplasty, the patient calls the shots.
You prefer that? Yep, absolutely. She can actually tell me and direct me to the way she wants her nose, a luxury that she wouldn't have had she been asleep during a procedure.
Amazing. I mean, it was a quick change, and I like it. It's natural. I think if I go home and to my family, they're going to see this, and they're going to be like, oh, my God. Like, you know, they'll all want to do it now.
For Good Morning America, Andrea Canning, ABC News.
And joining us now is the pioneer behind the 15-minute nose job, who you just saw in the piece there, Dr. Cameron Rokhsar. Good morning to you.
Good morning.
So it's not a permanent thing, right? How long does it last?
It's not a permanent thing. It lasts for about a year to a year and a half.
And then what, the body just absorbs
Well, you know,
stuff?
this material is made up of calcium hydroxyapatite crystals, a material that we all have in our body. It's found in our bone and our teeth.
Huh.
And so what happens is that with time, it slowly gets resorbed by the body.
And that's safe?
And that's perfectly safe. The material has been around for many, many years, for seven to 8 years, and recently it just got FDA approved about a month ago for injection into laugh lines, as well as correcting something called HIV lipodystrophy in the face, where HIV positive patients can actually get hollowness in their faces.
Hollowness, so it helps fill gaps in, basically.
Exactly. It
which
restores
makes
volume.
me think that it's not maybe for everyone who wants to fix their nose, right? I mean,
Well,
is it a certain patient you're looking for?
It's certainly there are individuals who are ideal candidates for the procedure. Patients who have a bump on their nose and they want to diminish the appearance of the bump. Patients who have dents or deviations on their nose. Patients who want to add a bridge to their nose, who, you know, and that's a common problem in Asians and African Americans. And basically patients who are not ready physically and emotionally to get a nose job, and they want to take their
go
nose
all the way
exactly
to the surgery,
for
right.
a test run, we can call it, you know?
A test run. And how much does it cost?
It costs between $800 to $1,500, depending on what we do and what we use.
So not cheap and not covered by insurance.
Not covered by insurance, but it's really a fraction of the cost of a surgical rhinoplasty when you think about it.
Yeah, and quick.
And it's quick. It takes 15 minutes, no downtime, very little risk. You're awake. You're interacting with your doctor, which is really nice. You can actually guide your physician.
Yeah, that was pretty cool, the way she was telling you what she wanted her nose to look like.
Exactly.
Very interesting. Dr. Rokhsar, thanks so much.
Thanks very much.
Appreciate it. We'll be right back.